We just completed another meeting of the White House Coronavirus Task Force. It's been a very busy and a productive day here at the White House. President Donald Trump has no higher priority than the safety and health of the American people. And the President has directed our task force, employing the full resources of the federal government in full partnership with state and local health authorities, to make that priority a reality. As I stand before you today, we have more than 100 coronavirus cases in the United States. That is counting domestic cases and cases of coronavirus of Americans that were returned from China or the Diamond Princess. I'm pleased to report that most of those who contracted coronavirus within our care are continuing to recover. But sadly, we received word today that another American has passed away, and their family has our deepest condolences. That being said, thanks to President's strong leadership and the professionalism of all of our federal agencies, Health and Human Services, CDC, and state and local health officials all across this country, the risk to the American public of contracting the coronavirus remains low. To be clear, if you are a healthy American, the risk of contracting the coronavirus remains low. But it is still a good idea to engage in common sense practices that are always recommended this time of year. So, as someone who has a mother who's 87 years of age and who has married kids living around the country, a brief tutorial on prevention for yourself, for your family, and your loved ones. It's a good idea to stay home when you're sick. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with tissue. Throw the tissue in the trash. Clean and disinfect frequently. Wash your hands with either a disinfectant or with soap and water for at least 20 seconds. And let me say again, as we've said before, there's no need for Americans to buy masks. And the common sense practices that I just described are all available at cdc.gov. Today we had a series of meetings here at the White House and on Capitol Hill. We met with executives of the airline industry, the executives of commercial labs, executives of nursing homes. And our team also met with the Republican and Democrat caucuses in the House of Representatives. And we were pleased to learn that just shortly ago, the House of Representatives passed a federal funding bill by a virtually unanimous margin. It'll now move to the Senate. And the legislation implements the President's vision to ensure that not only do our federal agencies have the support and resources that they need, but also that our state and local partners have their support. And in my conversations with governors all the way through this afternoon, I know they're grateful for the and leadership. We brought together today at the White House the leaders of all of the largest commercial laboratories in this country, companies like Quest that have vast capabilities, logistics and testing capabilities. And we were pleased to report today that they have created a consortium to share information and to share resources, and literally have told us that as they go through what is called the validation process on testing, that by next week, individual companies will be able to do, as they said to me, thousands of tests of coronavirus if they are needed and required, and many, many multiples more of that in the not distant future. Our objective here, as Dr. Birx raised with the task force, is we've got hospitals in affected areas and those that are requesting that have kits. We've got universities and state labs that now can perform the test on a requested basis. But our objective ultimately, and as quickly as possible, is to have tests made through these commercial laboratories and commercial providers that your local doctor, your CVS, your med check is able to have a coronavirus test. And that isn't there yet. We're working to make that a reality. But again, it's one more example. It's not just a whole of government approach, it's a whole of America approach. And whether it be our nursing home industry, whether it be our airline industry, whether it be our commercial laboratories, I can speak on behalf of President Trump and our entire task force when I say we are profoundly grateful for the spirit that's being reflected by companies all across the United States of America. Grateful for the leadership at the state level, and the American people should be confident that that spirit of partnership is going to continue to drive this at every level as we work our way through dealing with the coronavirus in the United States. With that, I'm going to recognize Dr. Deborah Birx for her comments.
Thank you, Mr. Vice President. Good evening. Over the last 12 hours, we've been able to receive information both from South Korea and Italy, adding to our China information. And it's as we thought. The elderly and pre-existing conditions have a more serious illness when confronted with the coronavirus. Reassuringly, in South Korea, no one has died under 30. This is reassuring to us, and the median age in Italy was 81 of those who succumbed. Those who became ill, the median age was 60. So we find this data reassuring, but it also has really caused us to focus on the Americans who might be most vulnerable. So we're focusing resources, attention, and all of our capacity to ensure those who have pre-existing conditions and those who are elderly have access to the best prevention and treatment options. The prevention options flow right through all of us to ensure that we have good protective hygiene.
Our nation's nursing homes and hospitals around infection control. So all of that information went out this morning.
Very good. Thank you, Seema. CDC, Bob Redfield. Bob.
Yep. Thank you, Mr. Vice President. I think what I'd like to highlight today is to first echo what the Vice President started with when he was giving the American people the advice that he did as he went through, that we do have listed out on our CDC website, cdc.gov. It really is very important. It's very pragmatic about washing your hands, 20 seconds of soap and water, or using the other disinfectants. Obviously training yourself to cover your sneeze or cough, either in your elbow or with a Kleenex that you will dispose of. I think these are very important things. Working hard not to touch your face. I think the most important thing for many of those individuals that might be a little type A, if you get sick, stay home. You're not helping your colleagues by going to work sick. And again, I think these are just very pragmatic. We've listed them. They're absolutely no different than what we ask the American public to do for flu. The second thing I would like to do is continue to get the help from you to get those messages out. The one that's the most important that the Vice President also talked about is the role of masks. We need these N95 masks for the healthcare workers that are taking care of these patients. We do not recommend them to be used by the general public. And again, you all, if you tell the stories, are able to be great communicators of that, so that the American public gets accurate information and gets good guidance from your experts that you'll reach out to for your stories. So that's what I would ask you to do. And I'll reiterate what the Vice President said at the beginning, that although we're continuing to see new community cases in this nation, the overall risk to the American public at this time still remains low. Thank you.
Terry Azar be with you. Is that a meeting that the governor asked you to come there? Can you explain?
I've spoken to Governor Inslee, who I know well from our time in Congress together several times since being tapped to lead the White House effort on the coronavirus a week ago. He's been providing strong leadership for the state of Washington. They have an outstanding health department. But after meeting with members of the Senate and the House, particularly those from the Washington State delegation, we thought it would be important to bring our team out, to meet with their team on the ground, and to make sure that they have the full support. Our hearts go out to those that have been infected with the disease in the Seattle area, but also we understand the anxiety this has created in the full community, and we're going to be going out just to make sure and sitting down with the governor and with his team that they have everything they need and all the support they need to see to the health of their people. President Trump authorized this weekend. Now, every state health lab and university lab can conduct a coronavirus test, and that expands the capacity. But ultimately, as Dr. Birx will explain, our objective is, in addition to those tests being available, we want to get to a place where any American from our airlines. But let me let CDC speak to the other issue.
Thank you, Mr. Vice President. So we are working in support of the California Health Department that's in the process of evaluating another cruise ship where they do have confirmed cases. We're at the very beginning of that, looking at the manifest to make sure we understand who's gotten off the cruise and where they got off the cruise, and we're really involved in that entire contact follow-up as we speak right now.
Last question, guys.
Mr. President.
Right here.
Thank you very much. Possibly a question for Dr.
Something that they need to take into context, and that's why we were very clear about providing that information, because we really want everyone to know what we know, that we've received this new data, we've gone through it carefully. It does look like there is significant greater risk of serious illness as you become older and if you have other medical conditions. Now, what I talked about also was protecting the elderly and protecting those with other medical conditions. And I want to be clear, the other medical conditions included people recovering from cancer. So just as you would protect them when they have their chemotherapy and their immunoresponses are lower, you would do that with careful hand washing again, and ensuring if you have children in the household that they're following those same procedures. I have a 9-month-old and a 2-year-old grandchild, and the 2-year-old has learned to wash her hands carefully. And I think these are just things we need to ensure are happening every day in households.
Mr. Vice President.
Us to be there for that community, and we'll be bringing our task force out to make sure that Washington State has all the support that they need, and that's the purpose of the trip.
One more question. Thank you, Mr. Vice President. I appreciate it.
Various discussions among the task force. I would think that if we were in a situation, and hopefully we never even approach that, where you have clear, wide, diffuse community spread throughout the country, and you have to have federal mandates that come in to essentially enforce certain types of social distancing, I think it would have to come to that. But I'm a bit humble about that. I would like to discuss it with a variety of other people who have more of a handle on the implications of that.
Would you say we're
It's probably a very good place.
sorry? I'm sorry,
Very good
Mr.
place to step off. We're gonna go back to work, but let me end where I began, and that is to say, today in the United States, the combination of domestic cases and people that we have brought home from China and from the Diamond Princess, we have slightly more than 100 cases, and the vast majority of those people either have recovered or are continuing to recover. Now, that's not going to lessen the focus that President Trump has charged us to continue to put on this issue. We continue to work closely with members of Congress to make sure that we have the resources to confront the spread of the coronavirus. But at this moment, I have to tell you, our state and local governments around the country are just doing an exceptional job. And as a former governor, I can tell you that the people that are on the ground, the healthcare workers, the health officials at the state level, are responding to this with compassion, with professionalism, and a big part of our job right now is just to make sure that they have the support, that we come alongside them, that they have the personal protective equipment and gear to be able to minister to anyone who has the virus. But I think the American people can take some comfort that the reality is today that the risk of the coronavirus to the average American remains low. And as we continue to take these steps, as Americans continue to take common sense practices to protect their own health, the health of their family, we'll work to keep it there.
Can you
Thank you.
provide some guidance to the uninsured? Can the uninsured get tested? Gentlemen, ladies, can the uninsured get tested?
Screaming for the camera isn't going to get you anywhere.
Well, how about answering the question?
We would like an answer to that question.
That's a valid question. Could you answer it?
What was your follow-up going to be to me?
What happened?
Regard-